Hello, I'm Jane Belford, Chancellor of the Archdiocese of Washington, here with some important updates regarding the Department of Health and Human Services mandate, which requires that employers include abortion-inducing drugs, contraceptives, and sterilization in their employee health plans. The Archdiocese has long expressed its concern about the serious religious liberty issues presented by this mandate, which forces religious employers to provide coverage for drugs and procedures that directly violate the teachings of their faith. At the heart of our concern was the definition of religious employer that HHS used for determining who is and who is not religious enough to be exempt from compliance with the mandate. The exemption provided for religious employers was the narrowest ever in federal law. It did not exempt any religious organization that serves the public, not just its own members. The proposed definition distinguished between Catholic churches, which would be exempt, and the organizations that carry out their charitable mission, such as hospitals, schools, and charities, which would not be exempt. But these organizations are as religious as our churches. The second problem with the mandate was the proposed accommodation for religious organizations that do not qualify as religious employers. The government said that those employers' insurance companies would provide the objectionable coverage for free, without passing the costs along to anyone, although it did not explain how that would work. For the last year and a half, we and other religious organizations nationwide have filed formal comments with HHS in the hope that, consistent with existing federal law and the Constitution, HHS would expand the exemption to include organizations that are indisputably religious. In a further attempt to resolve this issue, we joined 43 other Catholic dioceses, schools, universities, hospitals, and social service ministries in filing lawsuits in federal courts across the country. So, where are we now? Recently, HHS proposed some revisions to the mandate that we hoped would address these concerns in a meaningful way. However, after carefully studying the proposed new rules, it appears that they do not alleviate our religious liberty concerns. First, the religious employer definition is essentially unchanged. The exemption still distinguishes between houses of worship and their ministries of service, continuing to reflect a misguided understanding of religious freedom that is limited to the freedom of worship. Under the new definition, Catholic organizations, including many schools, hospitals, and charities, still do not qualify as religious enough to be exempt. This is clearly wrong. These organizations are no less religious than our churches themselves, since they are an expression of our Catholic faith and integral to the Church's mission. Second, the so-called accommodation offers no substantive relief. It is just an accounting maneuver that, like the cosmetic change to the religious employer definition, does not fix the essential flaw. It still requires Catholic organizations to provide, pay for, and/or facilitate access to objectionable drugs and procedures that violate deeply held religious beliefs. What is most disturbing, though, is that the proposed new rules eliminate an important protection for Catholic organizations that participate in religiously sponsored health plans. Previously, HHS had made clear that if an entity was a religious employer and therefore exempt from the mandate, that exemption could extend to all other religiously affiliated organizations that participated in that religious employer's group health plan. Many groups of Catholic organizations across the country, including the Archdiocese and its affiliated ministries, run their health plans this way so that they can offer health insurance coverage consistent with their religious beliefs. The new rules eliminate this option. Clearly, these proposed new rules do not resolve the religious liberty issues presented by the HHS mandate. The Archdiocese and other organizations across the country have once again filed comments with HHS, urging them to adopt a definition of religious employer that recognizes that religious liberty is not limited to freedom of worship, but also protects the freedom to exercise one's faith, and that religious organizations are not just houses of worship, but include ministries of service that are an expression of that faith. To learn more, please visit preservereligiousfreedom.org. Thank you for your time.